The issue of in vitro fertilization has drawn renewed interest after a provision related to IVF coverage for service members was removed from the National Defense Authorization Act, or the NDAA. And while not surprisingly, Democrats are up in arms over the provision's removal.
IVF, we all understand, is there's language from pro-life forces that they want to put in there about protecting the embryos forever, that is very impractical. So you've got a lot of Republicans who are strong supporters of IVF, and you got a lot of others said, I can't support it unless it has this pro-life language. So it was a clash within the Republican conference that they could not resolve. As far as I know, pretty much every Democrat would support it.
That was Congressman Adam Smith, the ranking member on the House Armed Services Committee. And as he points out, the issue isn't so clear-cut for Republicans who have been divided over the issue. But let's get past all the news and the noise here. Why is there a controversy over the procedure? What does the process actually entail? Well, here to answer these questions and more is reproductive endocrinologist and infertility physician Dr. Lauren Rubal. Dr. Rubal, thanks so much for joining us here on Washington Watch. Appreciate it.
Thank you for having me.
Now, for much of your career, you actually did in vitro fertilization. You thought what you were doing was the best way to help couples that were wanting to have children, which is kind of pro-life. We want kids. We want parents to have kids. What changed for you?
Right, exactly. And I think the first thing to say is that these couples are truly suffering, right? And I wanted to help alleviate the suffering, to help them have children. But what changed was on many different levels. I mean, first of all, medically, I felt more and more like I was putting Band-Aids over causes, that I wasn't truly addressing the root cause of that person sitting in front of me, body, mind, soul. And in many cases, this is true. We know that IVF is kind of a blanket recommendation for most infertility diagnoses that we have. So that was one I just felt incomplete in terms of my armamentarium to help treat these couples. The second part is that there are medical issues with the practice of in vitro fertilization. Of course, part of that, like I said, is not truly addressing the full spectrum of causes that, if we heal, can lead to pregnancies on their own and healthier moms and babies in that process. But again, we know there's an increased risk of complications for moms and babies. And then finally, the last part of this is really coming to terms with the fact that as I sat there performing my daily work, I began to realize more and more how many embryos were being destroyed in this process of in vitro fertilization. And so what I initially went into thinking of as helping life, really in that interim process, if every embryo is a human being that is a unique chromosome complement at his or her earliest stage of development, we were just starting on average, many more embryos potentially to get to that one live birth.
So it has health implications for it, but it has moral and ethical implications when you're talking about these human embryos that are being destroyed, discarded, or frozen. In some cases, we have millions of these that are frozen. But here's the dilemma. You started with this. These couples are suffering. They want children. I have 5. There's nothing greater than having kids, I think, as a parent. You love it. So you want to help them. But it's been portrayed as if it's all or nothing. It's the IVF or there's no other alternative. That's not true.
That's correct. There is another alternative that unfortunately has felt more and more politicized in recent months. But this alternative is called restorative reproductive medicine. And what that is really, again, identifying those root causes and harnessing the hormone imbalances that may be present, looking at the microbiome, trying to optimize ovulation in that woman as well as the sperm in that man, and really the timing of intercourse as well, and using medical and surgical procedures to do so. And the studies actually show that this is yielding equivalent rates of live births compared to IVF cycles. The denominators are a little bit different here, and so it does take more time. But with that being said, there is absolutely hope, and it is, again, effective. It is immoral, and it is a much less financially taxing process for couples.
Well, I mean, that seems like that should be something that if the government wants to address this issue, starting with the military, which they always use the military first so that they can expand whatever the social program may be. So as you're describing, this approach is both ethical, it doesn't have the health implications, and it doesn't cost as much. It seems like this would be something that we would be promoting.
Yes, exactly. And, quite honestly, Tony, this is just simply good medicine at its core, right? We want to be able to heal people as opposed, as I said, treat IVF as this episodic phenomenon that we're putting a very fancy Band-Aid on. However, unfortunately, what I find, and I can only speak for myself, but I know that I wasn't equipped with all of the tools. And in fact, studies that have been done looking at even fertility awareness-based methods, which can double the chance of conception over a period of 6 months in people who are trying to conceive. Only 4% of OBGYNs and family medicine physicians were familiar with how to effectively counsel patients on these type of procedures.
Dr. Rubal, let me ask this final question here. We have just a little over a minute left. Having been involved in IVF and involved in that process and those treatments, and now moving over to an ethical, more medically sound approach, how do the two compare to you as a professional in practicing medicine?
Yes. I mean, again, I think that for every single medical professional, everyone's trying to do their best, again, with the tools that they're given. I can, again, speak for myself, and I know that I feel so much more at peace, and this is what I tell patients. Not everything is in our power here. But let's try to optimize the parts that are, and then we can have a path moving forward in peace. And also, again, knowing that we're going to be helping you feel better because we're going to normalize whatever we've uncovered. And again, studies support that we're having babies based on these restorative reproductive medicine procedures who are healthier, who have less preterm deliveries, less multiples, and are being born at normal birth weight. So really a win-win.
Well, Dr. Rubal, I want to thank you again for joining us, and I want to thank you just for speaking out on this, because as you said, it's been politicized, and sometimes that comes with risk, but I think the truth needs to get out there, and we appreciate you being willing to speak the truth. Merry Christmas.
Yes. Merry Christmas.